Friday, February 27th. We're on location today, broadcasting from Memphis, Tennessee. We're at the historic Peabody Hotel, and the hospitality here could not be better. We're very grateful for the leadership here at the Peabody and all the folks in Memphis who have welcomed in common sense for the American people to Memphis, Tennessee today. We're going to do a big interview in just a moment with Dr. Scot Glasberg, who is former head of the Plastic Surgeons Association. Continuing our coverage today of a massive policy shift happening around transgender surgeries in America. Now, it wasn't that long ago that several major medical groups and institutions supported allowing minors to receive these life-altering surgeries. But in the last few months, something is changing. The president's administration has pressured hospitals around the country to stop these procedures. A woman in New York was awarded $2 million from a jury in a detransition lawsuit. And just in the last month, major organizations like the American Medical Association and the American Society of Plastic Surgeons have taken the position that these procedures should at least wait until adulthood. No more surgeries for minors. Joining us now to discuss these major decisions by these medical groups is Dr. Scot Glasberg. He is the past president of the American Society of Plastic Surgeons. Dr. Glasberg, thank you, and welcome into the Scott Jennings Show.
Thank you so much for having me, Scott.
Yeah, appreciate your time today, Dr. Glasberg. Tell us, when an organization like the Plastic Surgeons makes a major policy decision, and it is a serious shift in policy like this, what goes into that kind of a decision? Take us inside the internal deliberations that ultimately delivered the statement that minors should not be receiving transgender surgeries.
So this is an iterative process that doesn't just sort of happen with the flip of a switch. We spent several years looking at the data and evidence in this area, specifically on gender-affirming surgery for adolescents and children, and found consistently that that data and evidence was of low quality and low certainty. We started to realize it back in mid-2024, and so initially we came out with a statement speaking just to that point, that the data was of low quality, low certainty. We cautioned our members through an advisory that if they're treating patients in this scenario, that they should be cautious, that it was difficult to establish a positive risk-benefit ratio, and that's what we're all about as surgeons and as physicians, is establishing a benefit. But then things continue to evolve. Multiple systematic reviews like the CAS report out of the UK, or a McMaster article that was posted in our journal, the Journal of Plastic and Reconstructive Surgery, and then finally the HHS report, which came out in November, all confirmed what we sort of already knew, which was that the data and science and evidence were of low quality, low certainty. So for that reason, it was sort of a natural evolution of a viewing of the data to come out with that statement that if we cannot, as surgeons, find a positive risk-benefit ratio, we're all about patient safety and patient well-being, that we should advise that these surgeries should be postponed, recommend, until the age of 19.
Dr. Glasberg, before you made this policy change, obviously in our culture there was a lot of political pressure on medical organizations and other institutions to continue to do these kinds of procedures. Talk to us a little bit about the cultural and political pressure that existed and how ultimately the organization decided, you know what, the pressure is not right. We're going to really look at the evidence here. You mentioned a couple of the reports that you looked at, but I think a lot of our listeners are interested in this idea that our culture and politics was pushing our medicine in a certain direction that ultimately the data just didn't support.
So a really great question, and one that I've had to address now since we came out with this statement about a month ago. And the reality is the beauty of being a medical and scientific organization, a surgical specialty organization, is that we don't bow to politics. We don't deal with politics. We're politics free. We deal with science and data and evidence. And so, for those that have sort of critiqued and said, oh, this is pressure from the Trump administration or HHS or something, it's simply not true. As I pointed out in my initial statement, we started this iterative process back in 2024 under a different administration with a completely different view of this. And so this had nothing to do with politics. I totally understand, sort of the tense, discussions around this topic and the political atmosphere. But the beauty of what we do is we are free of science. It's all about patient safety and taking care of patients first.
Dr. Glasberg, when the organization decided to make the decision, did you face a lot of internal dissent? Did you have members of the society that simply disagreed? And is there a lot of unhappiness, I guess, or is there pretty well acceptance of what you've done and that it is the right direction for the plastic surgeons?
Well, the positive comments, both from internally and externally, have been overwhelmingly positive. But of course, with such a heated issue, there will be some dissent and a difference of opinions. Not quite dissent, but a difference of opinion. And we acknowledge that. I was chair of a gender surgery task force. It was the goal there was not policy making. It was to try to build consensus among stakeholders with different views. We were never able to do that. That was a different process than this one. And so, sure, we've had pushback from some of our members, especially those that do this type of surgery. I think there's hopefully an understanding that, these things will continue to be discussed and the evidence will continue to be looked at. But right now, where we stand, that's where the evidence is. And again, we are committed to doing what's best for the well-being of our patients.
That voice you're hearing is Dr. Scot Glasberg. He is past president of the American Society of Plastic Surgeons. We're talking about the plastic surgeons' recent decision to no longer recommend transgender surgeries for minors, that those surgeries should be put off until at least adulthood. Dr. Glasberg, obviously, you're a practicing physician and you're heavily involved in your organization, and you do deal with policymakers and politicians. How difficult is it in our current political environment to deal with the different layers of government? Obviously, you have the feds, and they have a posture today under the Trump administration, which is different than the Biden posture. You have a hodgepodge of different regulations and rules and political pressures in states and in localities. Talk to us about how you all navigate the different political levers that you come into contact with every single day.
So as I mentioned, we put medical clinical care above all else, and that's what we primarily focus on. But if you read the statement that ASPS put out carefully, we're not for the criminalization of medical care. However, we do caution the members in the statement to be mindful of whether it's a ban or a law in a certain state that might make this care illegal or ban it, to be mindful of those laws. And, those are different, as you know, from each of the different 50 states. About half of them now have bans on this type of care. So we do caution our members, we advise our members to be mindful of what's going on in their states. But again, our focus is primarily on science, evidence, and data. Medical ethics, I should mention as well, is really important in this realm. And coming back to a vulnerable population of children and adolescents, and in terms of surgery, many of which are irreversible, I think that we have to put that above all politics, all pressures. Sure, do we speak to, different facets of government, whether it's the legislature or, the departments? Absolutely. But when push comes to shove, for us, it's all about clinical care and doing what's best for our patients.
Dr. Glasberg, I thought maybe I would just ask you to talk directly to parents for a moment. Obviously, parents are sometimes put in difficult situations. They're getting signals from their children. Their children may be getting signals from other people in their lives that their parents don't know about. They're interacting with different folks. You all have made the decision to say these surgeries should not be done until adulthood. Maybe talk to the parents of America. What would you tell them if their child comes to them and says, hey, I've, for whatever reason, decided I want to do this? How would you advise parents to deal with those conversations right now?
Another great question. I don't do these surgeries, but I know what I would say if I was talking to a parent in this situation. We don't start with the end game. We start at the beginning, right? And we know that a careful psychiatric evaluation, psychological evaluation, is critical to understanding what's going on with their children. In terms of pressure, we want to make sure there's no pressure like social media or peer pressure and things like that. That could go into the minds of these children and adolescents. And then there's a process that builds before you get to either endocrine or surgical care, which again has, right now no scientific basis in this population. There are other ways to go. There are other ways to treat these patients through psychological care. And, I would caution parents to do their homework. These are significant treatments. irreversible. And I would say if you're not comfortable, get a second opinion, get a third opinion, speak to a lot of different people. And I would make sure that I was comfortable moving forward, both with what they're going to do and also with the expertise of the person that they're seeing. Even on other procedures, we talk all the time about only seeing a board-certified plastic surgeon because of their training. That's doubly important here. Same thing is true for whether it's a psychiatrist or an endocrinologist or any other person they might encounter in their discovery of what is going on with their child. And I think there's a lot of empathy that needs to be said. No one is suggesting that these children don't have concerns, issues, that gender dysphoria may not be real in those patients, but I think they need to be guided along a course of what is safe and in the best interest of these children.
That voice you're hearing, Dr. Scot Glasberg, past president of the American Society of Plastic Surgeons. Dr. Glasberg, thank you so much for taking the time to talk about this huge issue with us today.
Thank you so much for having me, Scott. Great seeing you.
Thank you, Scott. Good to talk to you, sir. When we come back, we're going to get back to the story, the breaking news. We may be on a war footing with Iran. I've got an expert on America's posture vis-a-vis Iran coming up next. Stay with us here. Common Sense for the American People on Salem. Stay with us.